Proximal hamstring tendinopathy is the subject of today's Dr. Ozello's sports medicine report. Proximal hamstring tendinopathy, first of all, it's a mouthful. It's kind of tough to say. As you just see, I stumbled on it a little bit. But it is an injury that occurs at the very origin of the hamstring muscles, which is right here at this bone called the ischial tuberosity. A lot of people will say, Doc, I have this pain in the lower part of my butt and the upper part of my hamstrings. And that is most likely proximal hamstring tendinopathy. Now, the hamstrings are the big muscles on the back of the thigh. They work very hard in all activities, but in especially sports. Proximal is a definition, a medical definition, meaning that it's closer to the trunk. Proximal the proximal hamstrings are here, while distal hamstrings are down here. So that is closer to the core or the trunk of the body. It would be the same thing if it was the arm. The proximal part of the upper arm is right here, while the distal part of the upper arm is right here. Tendinopathy is a disorder or disease to one of the tendons. Now, obviously, this is a disorder to the origin tendon of the hamstring muscle. The definition of a tendinopathy is a disorder or a disease of a tendon. A tendon is strong, tough, fibrous tissue that connects a muscle to a bone. In the hamstrings, these tendons work extremely hard. The hamstrings are major movers. The hamstrings also have a high number of fast twitch muscle fibers or type 2 fibers. When these fibers contract, they put a large amount of demand on the tendon. So these tendons, they are always working. They are taking a beating. In proximal hamstring tendinopathy, what happens is this is an injury that is almost exclusive to runners. Not 100%, but almost exclusive to running athletes, especially athletes who run up and down steps or run up and down hills during their training, athletes who do a lot of sprinting. And the reason for that is because when the hamstring is put on an extreme amount of stretch, that irritates the origin tendon. Like I said, the hamstrings originate right up here in a bone, in a part of the pelvis called the ischial tuberosity. That's where the tendons originate, or that's where the muscle originates at. That is the spot where the tendon connects to. When the hamstrings are being stretched, there's a lot of stress and strain being put on that tendon. When we are running, especially when we're sprinting or when we're going uphill, or when there's a large amount of hip flexion, that puts the hamstrings in a stretched position and sets up for this type of injury. Proximal hamstring tendinopathy is different from a hamstring strain. A hamstring strain is an injury that occurs in the muscles. Obviously, tendinopathy is an injury that occurs in the tendon. The mechanism of injury: overtraining. Doing too much too soon, putting too much demand on the hamstrings tendon. These muscles are very strong. They're major movers. When they are contracting, they put a lot of pressure on the tendon, and when they are stretched, there is a great demand on the tendon. So when we train, we want to make sure that we have a good routine. We want to make sure that we are recovering from our training sessions. Give ourselves adequate recovery time and recuperation time in between runs and in between training sessions. We also want to make sure that we eat properly so that we're getting proper nutrition to all of our muscles and to all of our tendons so that they can recover the way that they should. The symptoms of proximal hamstring tendinopathy are an intense, deep, dull ache in the lower gluteal region and in the upper hamstring area. Obviously, that's where the tendon is at. That's where the tendon attaches to the ischial tuberosity, so that is the location of pain. These symptoms can be aggravated by any activity where we are bringing the hip into flexion and any activity where we are bending the lumbar spine forward. Both of those increase the amount of stretch that tendon puts on the bone. The amount of stress that tendon puts on that bone and aggravates the tendon. Activities such as sprinting, running uphill, running downhill, accelerating, running stairs, those are some very specific sports exercises that can cause an aggravation of symptoms. Also, some weightlifting activities such as stiff-legged deadlifts, good mornings, those may also aggravate it if they are done too much. Sitting on a hard surface can aggravate this condition. Say if you're sitting on a bench in a dugout, a baseball dugout, that type of stuff really seems to aggravate it. If you have an office chair, get a good, well-padded chair because it's going to help a great deal. Anything that aggravates this condition, we want to try to eliminate. Also, this condition may come along with some other conditions. We may have what's called piriformis syndrome. That is a form of sciatica where the piriformis muscle, which is one of the gluteal muscles and is very close to the tendon, that muscle gets tight and can cause symptoms. So a lot of times when you have one of these conditions, you may have the other. Not in all cases, but sometimes that does occur. Now, one thing I didn't mention before I should have mentioned is that proximal hamstring tendinopathy has several different names. The one I'm using right now, that is the technical name. It used to be called high hamstring tendinopathy, and we also used to hear people say, oh, I have hamstring tendonitis or hamstring tendinosus. Now those are confusing terms. I like to use the term the proximal hamstring tendinopathy. That is the most official and that is the easiest for everybody because it's nice and clear exactly what it is. Several contributing factors exist for high hamstring tendinopathy. There are extrinsic factors, which are things that we do in our training or everyday life that are outside the body, and there are intrinsic factors that are inside of our body, could be from training, could be from everyday life, that contribute to this condition. First of all, let's go over the extrinsic factors. Like I mentioned before, proximal hamstring tendinopathy is an overuse injury. It comes from overtraining. So we want to have a good routine and we want to make sure that we are not overstressing these muscles and we are giving them adequate time to recover and giving the tendon adequate time to recover. Intrinsic factors, those are factors that are inside the body. A strength imbalance between the hip flexors and the quadriceps as compared to our hamstring muscles. This is what's called being quad dominant. If the quads are strong and the hip flexors are strong, the hamstrings are weak, they're going to overpower the hamstrings and they're going to shift our pelvis forward. Basically, you can't really see, the pelvis will be shifted forward like this. Now if you can see this, the hamstrings are put on stretch, the muscles are stretched, and the tendon is being stretched. That is a poor posture position that can be created by quad dominance and strength imbalance where the quadriceps and the hip flexors are overpowering the hamstrings. Also, tightness in the hamstrings. We want to make sure that our hamstrings are as flexible as possible. If they are too tight with certain activities and certain motions, it is going to put an additional amount of stress on the tendon. Another key thing is core weakness. If our core is weak, that can also contribute to the poor posture that I just displayed, but when we are moving, it can contribute to instability of the pelvis. When the pelvis is unstable, it rocks back and forth with certain movements and can put additional stretch and stress on the hamstring muscle and on the tendons. So we want to make sure that we are eliminating these contributing factors. Prevention is key in all sports injuries, especially an injury like proximal hamstring tendinopathy, where it is a non-contact injury. It is an insidious onset where it's not just one thing that causes it, it just builds up over time. So how do we prevent this injury? We prevent it by eliminating the extrinsic and the intrinsic factors. If symptoms should occur, act quickly. Do not wait. Do not hesitate. Do not pause. I know I said the same thing 3 different ways, but it's so important. That's why I said it. Any type of injury needs immediate care. Proximal hamstring tendinopathy is a very persistent injury, and it is an injury that takes a long time to recover from. The tendon in the hamstrings doesn't receive much blood flow as when you compare it to the muscles. The tendon also is very thick, so it takes a long time to recover. And this injury can also be reoccurring, so prevention should be your #1 goal. Rehabilitation of all sports injuries has 3 distinct phases. The first phase is the acute phase, usually the shortest phase of them all. The second phase is the intermediate stage, and the third phase is the advanced stage or the long-standing stage. The objective of the acute phase in proximal hamstring tendinopathy is to promote proper healing. Begin the healing process in the right direction. Proximal hamstring tendinopathy is a very persistent and often long-standing injury. So in the very beginning stages, we want to make sure that we are promoting proper healing. Do that by rest and applying ice. Rest is something that is necessary at the very beginning because you don't want to aggravate any symptoms. It's just for a short time. You want to avoid any positions or any motions or exercises that are going to aggravate the symptoms. Ice can be applied for 15 to 20 minutes. Always have a towel between the cold pack and the skin. You don't want to damage the skin. Take it off, take the ice pack off for about an hour, then you could put it back on again for another 15 to 20 minutes. We want to make sure that we are promoting proper healing, get the body moving in the right direction. You can also begin to do some very light exercises that will help you to remove the intrinsic factors of this condition. That is the objective in the intermediate stage, but you can start that in the acute stage. You just have to be very mindful of any position and any exercise that may aggravate the condition. In the intermediate phase, you want to concentrate on removing the intrinsic factors of this condition. So what we're trying to do is remove the source of the symptoms. Because we can treat the symptoms all day long, all week long, all month long, all year long, and it's going to help, but it's not going to help as much, and it's not going to prevent the reoccurrence as if we were going to treat the source of these symptoms. So we want to eliminate the intrinsic sources of proximal hamstring tendinopathy. How do we do that? We work on stretching the quadriceps and the hip flexors, strengthening the hamstring muscles. Now, obviously, any exercise that you do, you want to work through a pain-free range of motion, and you don't want to do any exercise that's going to elicit symptoms or aggravate current symptoms. Also want to strengthen the core muscles. There's a multitude of core strengthening exercises. Start with stability exercises and then progress to motion exercises. Start with the very basics and just build up from there. Also, you want to think about strengthening specific gluteal muscles. Now the gluteal muscles are core muscles, but I wanted to give them the extra attention that they needed, especially the gluteus medius, which is oftentimes weak in patients who have instability of the pelvis and who also have some hamstring conditions. So you want to make sure that you strengthen the gluteus medius muscle. Also, if piriformis syndrome is present along with this injury, you want to treat that. You want to stretch the piriformis muscle, you want to foam roll the piriformis muscle, do everything you can to eliminate the source of that condition also. In the advanced stage of recovery, or the long-standing stage, the long-term stage, whatever name you want to call it, the main objective is to return to activity. You still want to continue doing all of the things that you're doing to eliminate the source. But we want to slowly implement more functional activities that you're going to be using in your sport. Also want to work on what is called proprioception. Proprioception is the body's awareness of where it's at in nature. This is extremely important to prevent injuries and to recover from injuries, is improving your proprioception. We do that by working on an unstable surface. It may be a Bosu ball, maybe a fit ball, a wobble board. Things of that nature are definitely going to help you a great deal in recovering from lower extremity injuries. When you start to do activities, you want to be very mindful, functional activities, you want to be very mindful of how that hamstring is responding. It's going to take time. And you don't want to get frustrated, and you don't want to get to a point where you're pushing it too hard and you're re-aggravating the condition, because that's just going to set you back further. Sadly, that's going to set you back. So you want to take your time, develop a routine that is full of exercises that will help you and do not aggravate your condition, but you also want to modify that routine to whatever is working for you. If there's an exercise that's not working, that's making the condition worse, eliminate that exercise for right now. Just because it worked for someone else, just because I'm talking about it, or you see it on the internet, or you see it in a magazine or an article. If it's not working for you, then eliminate that one for right now, or modify it, and then if you have eliminated it, come back to that exercise in the future. Listen to your body's signals. That is the best way to recover from any type of injury, but especially to recover from this type of injury. Seek professional care. Do not hesitate to get a professional opinion. I've treated patients with this condition in my office. There are several things that a doctor of chiropractic can do to help an athlete recover quicker and recover better from proximal hamstring tendinopathy. First of all, a chiropractic adjustment. That will help to restore proper skeletal motion. Lumbar spine, pelvis, hips, knees, the entire lower extremity is what we want to target when someone has this condition. That will help to optimize the nerve flow and will help to reestablish proper skeletal motion. Also, patient education. When I am treating a patient with any condition, I watch the way that they move. I listen to how they explain things. So that's what the doctor of chiropractic is going to do, is he's going to find all these clues that are going to help you. It's called patient education, going to help you to recover thoroughly and correctly from this condition. In conclusion, I hope this video has been very helpful to you in the prevention of this persistent injury and in the rehabilitation of proximal hamstring tendinopathy. It is a chapter in my book. It's chapter 6, page 38 in my book, Running, Maximize Performance and Minimize Injuries. Gives you a lot of details. I just went over a lot of details. I'm also going to create a playlist. I didn't do any exercises. I didn't do any foam rolling or stretching on this video because I didn't want the video to be too long. So I'm going to create a playlist where there are exercises and all types of things that you can do to help yourself patient education things that you can do to help yourself to prevent this injury and recover from this injury. This is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Train hard, train smart, stay injury-free, and accomplish your goals.